Doing a video on cancer awareness. This will be the first of many because I have decided to embark on a project to raise awareness. On February 4th would have been World Cancer Day, and the theme for 2021 is I am and I will. Together, all our actions matter. The World Cancer Day organization has embarked on a 21 Days to Impact challenge, and they have challenged you to do one of 5 things. You can do all 5, but just choose one of 5 things and make an impact on cancer. I will put those 5 things somewhere here or here, and I have chosen to do most of it, but one that I'll be focusing on in this video is to eliminate cervical cancer or cervical cancer. So January would have been cervical or cervical cancer awareness, and in this video you'll see me getting my pap smear done, my first pap smear done. My experience was great. I did not experience any kind of pain or discomfort really. Only when they were swabbing I felt anything. Other than that, I did not feel anything. And I will encourage you, if you have not gotten your pap smear done, go get it done. I opted for the option to have my pap smear done privately. Reason being for convenience, lack of time to really sit in a health center and wait, comfort. This video is not sponsored by this organization. I paid for my pap smear to be done. However, I have volunteered and I do volunteer with this organization from time to time. This is my first time experiencing one of their paid services. I have accessed their free services when they have done outreaches before, but it's my first time accessing a paid service, and I must say that I was pleasantly happy. They were very professional and everything was explained to me while it was being done. I really would recommend it. I will leave the information in the description box below. So if you want to reach out to this organization and have your pap smear done by them, feel free to do it. The information is down below. The government has provided an avenue for citizens to have their pap smear done. You can visit your local health center to have it done free of charge. However, with COVID and stuff, I would advise that you call in advance in case there are days or times or a change in protocol, but you should be able to access it at your local health center. Make use of those tax dollars. And let's get into the pap smear. So to start off, your credentials.
Okay, so I'm a trained oncology nurse, right, a BSc in oncology. I've worked with cancer patients like for the last 10 plus years. Being a registered nurse, I'm not going to go through all the other work occupational leadership. I'm not going to go through those certificates because this is specific now for health and cancer. So, and also the head nurse of the oncology department at Zamfara General Hospital. Really and truly my passion, I was placed in an area where I knew that my God led me, indirectly so to speak. Right? So even though I have the paper credential, I have the spiritual credential also, right? To help people have an intervention where people may need information, have a desire for things like that. So generally, going back to that, a degree in oncology.
Okay.
Be a bachelor's degree.
So I know you're telling me 21. I usually hit 25. So the age to have a pap smear recommended 21 once you're sexually active.
Once you're sexually active is from 21.
Okay.
Yeah.
So why do people normally say 25?
Okay, so who we are be specific now?
Well,
who are the people? Is it medical personnel?
Medical
or
personnel.
just chatting?
No, medical
Right,
personnel.
right.
I've always said 25.
Okay. Well, so like I mentioned before, while we were doing the physical pap smear, the guidelines keep changing.
Okay.
So the guidelines will change accordingly. Remember, you have a younger population who are more sexually active, right? Probably in the past year, you wouldn't have had a younger population so sexually active that early. So now the guidelines, the bar has changed, right? And again, you're looking at prevention. When you're looking at prevention, again, you always want to get something earlier, knowing that someone has been sexually active. So, and then if you go online, most of the information you'll get is 20.
Okay.
The majority.
So can you touch on what is the HPV virus?
So it's called the human papillomavirus, which, as I said, everybody has it. Men has it, women have it. It's a whole different strain of viruses that we have in our body, and then they are the ones that is specific to cervical cancer. So it's in a nutshell, human papillomavirus.
How effective is the HPV vaccine?
Well, again, we also have to go to the guidelines and what research say, right? So at least 85-90% it is very effective, and again, it is effective once it's taken at that earlier age. So if the later somebody takes it, the efficacy decreases. So somebody like me, the 50s, the 40s, the efficacy would decrease in terms of being 50% or 45%, whereas with the younger person, once they would have taken, as we say, there's a cry in Trinidad when they had suggested that, the schools, the 16-year-old, that is the best age for it to be most effective. And again, I know the other question may come up, well, the concern about side effects. Just as any vaccine that we would have taken, the response to everybody is different. So there are side effects to every vaccine that we would have taken. So the concern about side effects is very minuscule and for a small group of persons. So that concern should not be in terms of saving life or preventing cancer. Yes, I'm not finished. It is a concern for anybody, but it shouldn't be the major concern because the side effects are not detrimental.
Okay, you said you're heading in San Fernando General. What provision does the government have for persons getting pap smear done?
So the pap smears are being given at most persons' area health centers. You still have the private practitioners who people, again, it comes back to the comfort of person, but you ask me at the government level.
Yeah.
So at the government level, you have it there in the medical institution, the health center, people's local area health center. So what persons have to do, they have to find out, according to where you zone, if your health center do it. It should be done at the area local health centers. So those are provisions that the government would have had from Ministry of Health specifically have instituted, which we hope that people are utilizing, that they can go and get a pap smear, save some money, and then we still also have again at the private level, just going there a little bit, you have family planning, and it comes back to person's choice.
Okay.
So government level is free, privately there's a cost.
Okay, and finally, just tell the audience what is the importance and urge them to have a pap smear done.
Okay, so in terms of the importance, like I said, what a pap smear does, right, it picks up cell changes before it reaches the stage of becoming cancerous. So anytime we're talking about cancer or anything health related, we always look at prevention. There's an old saying that prevention is better than cure, right? So in terms of doing it at the required age, as early as possible, right? And according to the guidelines, it really helps save lives in terms of early detection. So if it comes back normal, great. Like I said, can pick up minor infections that can be dealt with. If there are early changes, there are changes that we can find at the cellular level where the smear was taken. So that is done, is graded, whether it's a low grade or high grade risk that a person would have been developing, but it's not to say that it's cancerous as yet, right? So again, when you think about that, it has not reached the level of being cancerous as yet. If it's a high grade, there's a procedure that can be done to remove the cell that was already changing. So what we tend to say, we look at it as in terms of a banana, right? You look at the outer level, you look at where the peel the skin, you look at the actual banana inside. So you have the superficial area outside of the banana skin, that's where you have your early changes, right? Then you have a peely banana, you have still the underside of that skin, and so you have that kind of mediocre changes, then you have a high grade change, it touches the banana. So it's starting to go down to that level, but it still haven't gotten inside the banana itself either. So you have those changes happening, and if it has reached where it already touched the banana, right, I'm just using that reference,
Yeah.
a procedure is done. So you remove that level of cell that was changing, so two things happen. That cell removes is a treatment in one also too.
Okay.
So that cell is no longer there. But that person is closely monitored. So whereas I have said to you, you need to follow up with your pap smear within 1 year, right? If a person has some changes and a procedure was done, whether we say it's a biopsy or remove those cells and send it to the lab for sampling to see if there's anything further going on, right? That person had to be followed up more closely. So that person will have to do their pap smear within 6 months rather than a year.
Okay.
Sometimes, again, let me just go back a little. If the changes are early changes, what some doctor may recommend is a low-grade change to repeat the pap smear in 6 months. The body has a way of clearing things. So yes, the person would say, well, why is sending back to the pap smear? Why not do the procedure? So in doing that a second time, it's a low-grade change, sometimes the pap smear come back.
Okay.
Right? So before sometimes they even reach to do any biopsy or anything like that, repeat the pap smear in 6 months' time. If it comes back as a cell within the cells are changing within the cervix, then the procedure is done. Right? So when you consider that of not somebody not having a diagnosis of having cancer, as opposed to you having a treatment and all of that, then you understand why a pap smear is so important. Again, I'm emphasizing prevention. If it is detected or picked up or it has progressed, when we have sent that sample to the lab and we did the biopsy, we're looking at early treatment and possible cure.
Okay.
Right? So again, in terms of encouraging persons to have their pap smear, the simple thing, it saves lives. It might be uncomfortable. So what I usually say to a person, 3 minutes of discomfort, think about 3 minutes of discomfort as opposed to years going on the road with your finances draining, your health has waned, it has deteriorated, as opposed to 5 minutes of just having a pap smear. So while may have a lot of young friends, colleagues, whoever you work with, that's the kind of information we want being shared. Right? So you can tell them, okay, I have this bit of information. In order to enjoy the greater part of your life, have a pap smear. Yes. And as I said, it's being done at the florist, in the comfort of the florist, yes.
You gotta plug the business.
People can schedule in an appointment when they want it, and in about a week to 2 weeks, you have your report. Right? If there's any change, we'll call you in and discuss, well, what was the change. If it's normal, we still inform that person that it is normal, right, and advise them to ensure that they have the pap smear as scheduled. So first thing first, you find out if you ever had a pap smear, right? You would have done the history taking, the age and all that. So what's the age?
25.
Right, so the recommended age for somebody having a pap smear, to start having pap smear is 21 years once they're sexually active.
Okay.
Right, if you're not sexually active, it's not necessary. And the guidelines has changed, so they keep updating the guidelines. So the pap smears now is based on according to age and how often you do it. If it's every 2 years, if it's yearly, every 3 years, and all of that too. And since it's the first time you're having a pap smear, still relatively young, you will have to do another one next year. Right? So what we use are disposable instruments only. Right?
Okay.
So the speculum is disposable. We always should strive to use the correct size for that particular person. So you don't have any children, I will look at the size of your hip and all of that, kind of gauge it from there. So again, always to determine the correct size of speculum for people, because sometimes people have a bad experience because the person who did the pap smear didn't use the correct size. So it traumatized some people.
Yeah.
Right? So for me, being a first-time pap smear, don't have any children, I would start with the smaller size.
Okay.
So what I'm going to do, as I say, you can use either the KY jelly or you can use water. And even if you're using KY, try not to use too much when you put it on the tip of the speculum so that it doesn't get into the speculum when you're doing the pap smear.
Okay.
Because I have to use a brush and a spatula. So that could affect you getting the correct sample, the cells.
Okay.
Because what we're going to put on the slide are cells from the cervix.
Okay.
Right? So when I insert the speculum, I open. There's a light source that will guide me, and I have to find the cervix. Right? And what we're saying is the lower part of what we will say in layman terms, the womb. Right? So that's when we talk about the cervix, we talk about the womb, and it's the lower part that as it enters right into the vagina area there. So that is the area I'm going to take the pap smear.
Okay.
So two things gonna happen. So the brush goes insert into the cervix itself and make a 360-degree turn clockwise and then counterclockwise. And after I would use the spatula. The question will be asked why. So the spatula is going to be the outer part of the cervix. There's a junction that we call the squamous columnar junction, where two different types of cells meet there. So
Okay.
hence the reason why we use the brush and we use the spatula.
Two different instruments.
Because more than likely, that's the area where the cell changes in terms of us picking up any changes when we do the results. And after that is done, it's put on a slide. Then there's a fixative that seals the sample that I have taken. So that sample is fixed.
Okay.
It can stay on for a day, 2 days, but that sample doesn't change, it is fixed. Once I have put that fixative onto it, right? A pap smear relatively is a very quick process once you find the cervix. The hardest part I tell anybody in a pap smear is taking off the clothing.
Okay.
Right, but once the cervix is found, you use the spatula, use the brush, that's it. Right? Sometimes there may just be like a contact bleeding, nothing heavy. So it might be a slight. You might just see light red blood after a while. That's okay.
Okay.
We call that contact bleeding, something from the speculum. Nothing to be concerned about. We tend not to do a pap smear too close to people's cycle, period.
Okay.
So hence the reason why we say not 5 days before or after. Some people may do it 4 or 5 days before or after, but not too close to the menses.
Okay.
Or when you're having, because again, the blood gets in the way.
Okay.
And we would not be able to get, sometimes for whatever reason you might get it, but
You
you
get
try
proper
not
sample.
to, you wouldn't get a proper sample. So try not to do it too close to the period. Right, so that's some people, those are questions that people would ask you again, well, why not close to the period, all those different reasons is what people would ask you.
Okay.
And again, when you're doing a pap smear, you're supposed to look. So that's why you have a light source. So you look, you're not just taking a sample. So you look at how healthy the cervix looks. So that's also what I'm looking for.
Okay.
You know, you're looking to make sure it's pink. It doesn't have any cysts, no growth or anything like that. So you're observing. So indirectly too, it's like a kind of gynecological gynae exam, and indirectly also too.
Okay.
Because the person is really supposed to look and make sure there isn't any what we call erosion of the cervix. So because of our skill and because of experience, you know what is normal, more than likely to know what is abnormal. Sometimes what the pap smear can also pick up too is minor infections, like little yeast infections and all of that.
Okay.
Bacterial vaginosis. So you may also find that when we get back the report, it will tell us that, hey, this was found on the pap smear. Sometimes somebody may say, well, I didn't have any discomfort, my discharge was normal. That happens too, but the pap smear is so specific that it will pick up little minor infections.
Okay.
Alright, not STDs and all of that, but minor infections. When you're doing a pap smear, you're supposed to look. So that's why I have a light source. So look, you're not just taking a sample. So look at how healthy the cervix looks. So that's also what I'm looking for. When I open the speculum and all of that, so when I put in the speculum, I have to open it to visualize the cervix.
Okay.
What you're supposed to feel is a little pressure. It will feel uncomfortable, right? But once that person, my technique is good enough, I ensure that you're comfortable, it really shouldn't be a painful procedure. All right? Tell me when you're ready. So pull the dress up away from the buttocks. Right. Let the knees fall apart. Good. So this is my hand touching you. And this is the speculum. This is now. Come down a little more. Good. Drop your knees a little bit more. Good. Any discomfort? No? So what I have there, I've inserted the speculum now. So what I'm going to do, I have to open it.
Okay.
Right, because it went in close.
Okay.
And again, that is for the person discomfort. You do not want the speculum pinching that person as you're inserting it.
Okay.
Alright, so now you will feel a little pressure whilst I'm opening it. So I'm pushing up, you will hear a little click. don't jump or anything, is because I have to open it and lock it in place.
Okay.
Right, so based on the light source, okay, so give me a look for one more time. Why I'm asking that is because I want to make sure all of the cervix where I'm going to take the sample, I can see it.
Okay.
Alright, okay. The muscles, in some people, indirectly the muscles, if you're not thoroughly relaxed, will push back all the speculum. So hence the reason I have to make sure I lock this in place really, really good.
Okay.
And just have a hole at the end of it. So what I'm going to do now, as I told you, I'm going to use the brush, as you can see.
Yeah.
And there's a part I'm going in the upper part of the cervix. Can you tell me any discomfort?
Just I feel ticklish.
So this is my hand. Let the knees fall apart as much as you can. Good. Good. Wonderful. Good. Going back again. Again, I'm opening. Opening. Cough again for me, Sarah. Bigger one. So I'm seeing this cervix, right? So the cervix is now coming into the speculum. Beautiful. So sometimes we wait for the cervix to find its way into the speculum. One more cough. Nice. So no pain, right? So I'm using the brush.
Okay.
When was the last period? Did the last period?
Last week, Saturday.
Right. I'm using the brush. So do the 360 back and forth, right? Now I can easily let go the speculum because you're a little more relaxed.
Okay.
I'm putting that first sample onto the slide. Last part of it now. I'm using the spatula, so you feel that scraping sensation.
Yeah.
And I'm using it, as we would say, right in the mouth of the cervix. So again, I need to get it right around, because that is the junction that I just mentioned to you, right? And in about 2 minutes, we should be finished. So I'm looking at also what you call a normal discharge for a woman. I'm looking at the neck of your cervix. It has this reddish look. Little brighter red than all the other areas. Right, so I'm using the spatula now. Spreading that second sample now. And what I want you to do is take some breaths with me, because I'm going to finish.
Okay.
So I'm going to, so that is unlocking the speculum. Take some breaths in out for me. And all I have to do now, so here you can look at it, is a slide here.
Okay.
So if you cast a light, you can see, and the slide has sections. So as to where you put the first sample that I take, and then the second one, and then now this is the fixative, what I will seal it in place with. So as I say, nothing hampers this when I put this fixative on this now. And then it's sent to the lab for testing, and in about 1 to 2 weeks, you will get the results.
Okay.
So how was that?
It was normal.
Right. And voila. That's the end of your pass.